So this is Günther Faber, and you're the CEO of OneFamilyHealth, and you were also in the panel this morning together with Baz and Angus. And I was just telling the viewers that you have great knowledge and expertise when it comes to M-health and digital health in developing countries. Could you just briefly elaborate on what are the challenges to bring health to these countries?
First of all, my knowledge on M-health and digital health was driven through necessity. I'm not an expert, but I use the experts to bring my model, which is basically entry-level healthcare, looking at primary healthcare and bringing quality healthcare and raising the standards, and M-health was the only way to go. Huge challenges you face, obviously, because the big problem in the developing world is that in the rural areas, healthcare is just about non-existent. You find a situation where there are no clinics. The clinics that are there, the staff might be demotivated. They, in actual fact, use what little is there to treat friends and family, or make a bit of money out of it. So it's very difficult, and these people have got to, in a country like Rwanda, they've got to walk up to 3 hours, a mother with a child, to get to a specific clinic.
It's nearly unfathomable.
So what you're looking at is improved quality of care and improve accessibility of care. And to improve accessibility of care is you bring the clinics closer to the patients, and quality of care is develop a standard system. And that's where franchising comes in, because franchising is based on standards. It's like quality management standards. It's no different to QMS in a laboratory environment. So everything they do, whether it's treating a disease or a condition, they have to do it in exactly the way that you tell them. And once you've got standardization, it becomes easy to replicate. So you can replicate the model. And once you start replicating, you obviously get the economy of scale. If you start buying more drugs, you can start negotiating better prices for your drugs. So it's overall a very good system to bring focus and to bring quality healthcare. And then the other thing is making it in the private sector. You bring the incentive in. The harder the nurse works, the more patients she's going to see, the better her practice is going to be, and the better life she'll have for her and her family.
That's a very nice summary. It sounds so simple. But I also know that when you were on stage, all three of you highlighted the fact that, there is technology in the developing countries in Africa, but the problem is the implementation. And there are a lot of pilots that are presented. So I'm just thinking, to keep it brief, for viewers, if there are any entrepreneurs or companies wishing to invest in these countries, what kind of advice do you have?
Well, first of all, if you've got a concept, it was the M-health concept, you run a pilot. As soon as you've run a pilot and you see it works, go into a commercial situation, go into real life, where you in actual fact have not 1 or 2 or 10, but you populate a whole area with the pilot that you have got. So the sooner you go from pilot to scaling, the better, because you're right, there are so many obstacles in the way of you're going to have the best program, you're going to have the most sophisticated system, and unless you find a situation, because ours app is a mobile phone with some sophisticated software. If the franchisee presses the key and she thinks it hasn't gone in, she represses it, so she sends the information twice, which means when it comes for reimbursement, there's a duplicate entry, and that causes problems for reimbursement. So there are even little things you've got to watch in terms of making sure it works. We've been now gone from a pilot in Kenya to implementation in Rwanda. We're in the 3rd year, and we are still learning and adapting and improving the technology base that we have got.
I know one word, just to summarize, I know one word you used when you were on the panel when you got this question, that was you need to have passion. I think that's a good summary.
No, you need passion. Definitely.
You need passion. That's a good thing.
Thank you
so much for your time, Gunther. Thank you.